Hello, my dear students. Good morning, everyone. How are you all? I hope you are all going good. Today, we are going to discuss about the most important topic, that is cardiopulmonary resuscitation. That is, in short form, we will call CPR. You know, everyone, why CPR is giving to the person. The person who is in need, we are going to give the CPR. That is nothing but the person who is unconscious. For surviving purpose for the cardiac arrest person and the respiratory arrest person, we are going to provide the CPR. Let's learn more about this CPR, how to give, when to give, okay, what is the procedure of the CPR, we will learn in today's class. So before going to see the definition of the CPR, so we have two points, major points in this CPR. One is the BLS, another one is ACLS. BLS is nothing but basic life support. What is BLS? BLS is nothing but basic life support. Then what is ACLS? It is nothing but advanced cardiac life support. Understood? The difference between the BLS and the ACLS. So now we will see the definition of the BLS and the ACLS. In the BLS, what will happen means, without using any equipment and any medications, we are going to save the life of the person. That is nothing but BLS, basic life support. It is a method in which the life of a patient is saved without any medications, machine or equipments. That is called BLS. And the difference between the BLS and the ACLS, in the ACLS, along with the CPR, we are going to provide means we are going to use some instrument like a defibrillator. You heard about that, to increase the heart rate. So here medical help is going to arrive in the advanced cardiac life support. Understood the difference between, here there is no any equipments, no medications we are going to use, but here in this ACLS, we are going to use the machine, medicine or other equipments. Understood? Most probably, we are using here defibrillator. Okay, next we will come to the main topic, that is the CPR. In that CPR, what is the definition of the CPR? How can you tell that it is what is the definition? So CPR is nothing but, before going to know the definition, we want to understand what is it, what is present in this CPR. C means cardiac, P means pulmonary, R means resuscitation. Revive. Resuscitation is nothing but revive. So when the cardiac arrest and the pulmonary arrest or the respiratory arrest takes place, at that time we are going to provide reviving. Reviving means rebirth to the cardiac and the pulmonary means lungs. So arrest happen means at that time we are going to treat we are going to revive that organs, which one is heart, another one is lungs. So that is the thing with cardiopulmonary resuscitation. Best how it will work, what actually happens in the body, that I will tell you. So this is the cardiovascular system, means part of the cardiovascular system, heart. So what's the major function of this heart? What it will do? Circulation, blood circulation. Yes, blood supply is there. What's in that blood supply only, that two system involves. Two system involves. One is GI system, another one is respiratory system. What's the function of the GI system? It supplies the nutrient. What it supplies? Nutrients. Yes. So what is the function of the respiratory system? It supplies oxygen. Yes. So what happens when the nutrients and the oxygen get inside the blood vessels? From the blood vessels, the supply of the oxygen and the nutrients takes place to other parts of the cells, which is present inside the body. Yes. So if it should be get from this, the mitochondria which is present inside the cell, it will release the energy. ATP synthesis will take place. Yes, ATP synthesis will be take place. If heart is not working properly, if the respiratory system is not working properly, how can we supply the oxygen to these cells? That is my question. Yes, that is actually work. If oxygen is not supplied to the cell, means how can the mitochondria will release the energy, synthesis the ATP? Yes, due to this, we can say that once the heart is stopped or the lungs is stopped, at that time we are going to provide the resuscitation to the organs. Okay. Okay, next we will talk about the indications and the procedure or the steps of the CPR, which is very important. So in the indications, already I informed that in the cardiac arrest and the respiratory arrest, for that we are going to do the CPR and provide the CPR. So what is this 4 minute golden period? Why it is called 4 minute? So after if the person met with an cardiac arrest or the pulmonary arrest, he having a time only 4 minutes. So before 4 minutes he didn't get to the CPR means the brain damage means brain damage means the blood supply which is not reached to the brain means to the brain the blood supply is not reached means at that time what will happen, the brain will get dead. If once the brain get dead means it is very irreversible process, we can't able to repair the brain. So it is 4 minutes is golden period, within 4 minutes we should provide the CPR to avoid brain damage, so which is irreversible. Yes. Next, we will talk about the important key point in the CPR, that is the steps. There are total 6 steps are there. What I written on the board. So, in the step 1, what we will do, scene safety. Scene safety means once the person fall down, so we want to take the person. For example, if the person fall down on the traffic road. So if there are too much crowd is there, traffic is there, we should not start to provide the CPR there itself. We should take the person to the calm and quiet place, which is and there is no any pillows, stones in the supine position. We want to give the patient the proper position and the scene safety. If crowd is there means we should tell them to go aside. So for other person, not to create any problems to the patient. Patient should also be safety, and the rescuer, those who are present to provide the CPR, they should also provide feel some comfortable. Next step to check a response. So after providing a proper place to the person, those who are going undergo for the CPR. So we want to next what we want to do in the step to check a response. So response in the check response, the patient is unconscious. At that time we want to ask, hello, are you okay? Whether we want to tap with the help of the person, we want to tap first and we want to ask, are you okay? What is your name? Anything we can ask. If he is also not responding, means we should start to means continue the CPR procedure. Next to check the breathing. Breathing means how we are going to check by looking, by listening and by feeling. So feeling, looking means observation is there, and listen whether he is breathing or not. If he is breathing, no need to continue the CPR. If he is not breathing, the breathing is also stopped means, so we want to start the CPR. And we want to check the pulse with the help of the femoral pulse. Also we can check carotid. The main pulse is here, carotid pulse we want to assess. Next, step 3, call for help with AED. What is this AED? AED is nothing but automated external defibrillator. Once you start the CPR, at that time you want to inform any other person, those who are standing during procedure time, means during CPR procedure. At that time you want to tell them to call the ambulance with AED. Okay. So next step for start compression. Compression is very important. For what purpose? If cardiac arrest happened, if the pulmonary arrest happen means oxygen is not supplying. Oxygen is not supplying means it will cause a major issue. It will make a major issue to brain damage. So we want to start the compression. So what is the location of this compression means xiphoid process. Xiphoid process means in the sternum, the end part of the sternum, we can see that xiphoid process. There we want to start the compression. And what is the depth of the compression? For the adults 2 to 2.4 inches we can tell. This what is the rate of the compression? 30:2 means 30 compression and the 2 rescue breaths we have to provide. So if one rescuer also there, 2 rescuer also there means 30:2 you have to provide. For one rescuer 30 compression, 2 rescue breath. Again you want to do the 30 compression and 2 rescue breath. But in the 2 rescuer what they can do means, if someone is doing 30 compression, one more rescuer want to give the provide the breathe, to rescue breathe. After that person only start the compression. Next person alternation, by alternately we can exchange, means the person can exchange to do the CPR. Okay, this is the rate of the compression. This is step 5, that is check the airway. After providing compression, we want to check the airway. So checking airway means simply we can't able to only compression is not need in the CPR. So along with rescue breath is also very important to provide the oxygen supply. So at that time, if rescue breath is giving, but it is not reaching to the heart and the lungs, means it will also create problem to check the breathing to check the airway. Any obstruction is there means we want to remove that one. So for to clearing the clearance of the checking airway, there are two procedures is there. Means for the simple procedure, that is the head tilt and chin lift maneuver. Head tilt and chin lift maneuver and the jaw thrust maneuver. In the head tilt chin lift maneuver, what will do means this is a head tilt. So they will what they will do when the person is on the supine position at that time, one hand this head will they will little bit move upside and the chin downside, but it is indicated for the person those who are having road traffic accident, injury is there means if the person fall down from the means fall down from upper what it will be from upside to long side, the distance is there, no? So means the height too much height from the, so at that time this head tilt and the chin lift maneuver is contraindicated. Jaw thrust maneuver only lower jaw is they are going to pull, later they are going to provide the airway. So how you are going to provide the means how the person is going to provide the airway means by pinching the nose and mouth to mouth they are going to provide the airway to rescue breaths. So directly now the infection is too much, so it is very difficult to provide the mouth to mouth rescue breath. With the help of any kerchief you can put the patient means the person's above the person's mouth, later you can provide the true rescue breath. These are the major steps that comes under the cardiopulmonary resuscitation. In this CPR what we discussed in today's class, we already completed this procedure CPR. Cardiopulmonary resuscitation, what is BLS and what is ACLS, that we already know. Yeah, okay. Next, the definition of the cardiopulmonary resuscitation means it is nothing but it is the life-saving procedure where we are going to reviving the heart and the lungs. That's all. In simple we can write. These indications we know, we already discussed, and the steps there are total 6 steps. See safety, check response, call for help, start compression, check airway, and provide breathe. If you have any doubts regarding this topic, you can comment in my comment section. Okay. See you in the next class. Bye.